Did you know that ADD, ADHD, dyslexia, Asperger's, and autism are all part of a group of neurological developmental disorders called the Autism Spectrum of Disorders, or ASD for short? ASDs currently affect nearly 1 out of every 11 in the United States. Many authorities now agree that this spectrum of challenges can be categorized as a spectrum of sensory processing disorders, no two of which are the same. This presents a challenge for traditional treatments. If every child is different, patient-centered care, not diagnostic-centered care, is critical for the success of a child facing any developmental challenge. I'd like to take a moment to talk to you about a recent article published in the medical journal titled Sensors in December 2016. The manuscript was titled Sensing Technology for Autism Spectrum Disorder Screening and Intervention. This paper discusses the importance of technology in diagnosing and treating patients with autism spectrum disorder. Currently, the common method of diagnosis of these developmental challenges is a checklist of symptoms with little focus on measuring sensory processing. However, this article identifies, discusses, and supports using technology to detect ASDs in 3 general categories: eye trackers, movement and sensory trackers, and sleep quality monitors. Patients with ASD have difficulty with processing and integrating sensory information. These challenges make it difficult for them to interact socially, maintain eye contact, read, learn, and focus on their teacher in school. Their characteristic hypersensitivities and altered movement patterns are noted in this paper as well. This paper reviews technologies that are relevant for autism spectrum disorder screening and therapy. The use of non-invasive diagnostic equipment affords a properly trained doctor the ability to assess many processing abilities such as tracking targets, balance, auditory processing, coordination of movement, cognitive efficiency, and communication. A chiropractic neurologist is specifically trained to perform an appropriate bedside examination, along with the use of sophisticated diagnostic equipment such as video oculography, saccinometry, posturography, QEEG, sensory integration, amongst other diagnostic tools appropriate for ASD to identify processing symptoms that need assistance. Early, intensive, and individualized receptor-based or sensory-based interventions have been shown to improve the developmental trajectory of the affected children. The earlier the diagnosis, the sooner the interventional therapy can begin, thus making early diagnosis an important goal. Technological innovations have created tremendous potential to assist with the early diagnosis and improve interventional programs. If you have a loved one who is diagnosed with or suspect any of the challenges on the autism spectrum of disorders, we suggest consulting with a chiropractic neurologist in your area. If you would like additional information on ASD, other types of brain-related syndromes, or the technology we have here at Plasticity Brain Centers, please visit the Resources tab at plasticitybraincenters.com.